Following the previous videos on vitamin D and COVID-19, I am going to present to you now a recent paper that was published last year, about 7-8 months ago. And in this paper, the authors examined the relationship between vitamin D levels and the severity of COVID-19, and they look at a different number of markers, inflammatory markers, severity of the disease, but also blood glucose, which is something interesting, and they find some pretty interesting relationships and correlations. So let's have a look what they found out. As you can see here, the authors wrote that a prevalence of vitamin D deficiency has been reported in COVID-19 patients in many studies now, and that's pretty clear. Furthermore, clear associations between hypovitaminosis, low levels of vitamin D, and overweight, obesity, and diabetes have been observed and have been recognized now in a number of studies. I am not going to go into the details of all the methods and materials they use, but they do show the data collection, their definitions, something important to know. Although it's nothing really specific to this paper, it's pretty well accepted definition now, but vitamin deficiency was defined as a 25 OHD level below 20 nanograms per milliliter, okay? 25 OHD relates to the form of vitamin D which is circulating in your blood, okay? And this form of circulating vitamin D relates to the vitamin D which has been converted into 25 OHD into your liver. So they discuss their methods and statistical analysis. We are not going to go into the details of this. You should, of course, know that there are 88 patients which were infected by COVID-19 and that were included in the study. Okay, and they explain how they chose these patients. And they give here all the details about these patients, their age. There were 2/3 male, body mass index, comorbidities. And you can see they had quite a few comorbidities: hypertension, artery disease, diabetes, malignancy, and they have all the different tests they did here. Okay, so that seems to be a pretty well done study. An important result from this study is that lower vitamin D levels were found in patients affected by severe disease, okay, compared to patients which had a less severe disease. So that's something which has been seen also in many other studies now. And this corroborates these other results. Now you can see here the relationships between the different markers and vitamin D levels here. At the bottom on the x-axis, you can see positive relationship here and negative relationships in the other cases. And these are inflammatory markers. We will discuss a little bit more about this in a second. One thing which is important, and we have talked about before, is the role of vitamin D as an immunomodulator, which means that it is able to modulate the response of the immune system, both innate and adaptive immune response. They also notice here a correlation between vitamin D levels and the severity of the disease and the outcomes. They also write here that recent systematic reviews and meta-analysis assessing the impact of vitamin D status on COVID-19 infection and related mortality concluded that low vitamin D levels seem associated with increased SARS-CoV-2 infection risk, and also COVID-19 severity and associated mortality. COVID-19 severity and mortality has been shown pretty clearly now. Regarding the risk of infection when you have low levels of vitamin D, it's less clear though, so I would be a bit more cautious about this. But there are quite a few studies that seem to indicate that maybe increasing your vitamin D level will reduce your chances of being infected. So in this study, they show results for a number of respiratory and inflammatory parameters, which are very important because they are usually associated with a degree of severity, a higher severity of the disease. Some of these are, for example, the PF ratio, which is here, and which is basically the partial pressure of oxygen measured in the artery divided by the inspired oxygen. Okay, and this, as I say, is one of the most useful parameters used in patients with respiratory diseases to identify those at higher risk of severe disease. And as you can see here, they show a positive correlation between the PF ratio and the vitamin D levels, okay? Meaning that higher vitamin D levels in your blood is correlated with higher PF ratio. And so what this means is that low levels of vitamin D in this range are associated typically with lower PF ratio and with higher severity of the disease. Now they looked at other inflammatory markers. The most telling and the most important maybe is the NL ratio, neutrophil to lymphocyte ratio, and they show a negative correlation, as you can see here. Higher levels of vitamin D are associated with a lower level of inflammation. And this also correlates with a decreased severity of the disease. And they also notice that other inflammatory parameters such as CRP and LDH and cytokine immune markers typically increased and associated with a severe COVID-19. And these were found to be higher in vitamin D deficient patients as well. As they write here, in our study we found clear associations between lower vitamin D levels and worse inflammatory and clinical parameters in COVID-19 patients. They also looked at the vitamin D and glucose level here, and they also measured the plasma glucose as a function of vitamin D levels. As you can see here, there is a negative correlation, and they found that patients with a low level of vitamin D and a high blood glucose were more at risk of severe COVID-19. Okay, so that's something very interesting. When you have both low level of vitamin D and high glucose, your chances of getting severe COVID-19 increase. They also found a negative correlation between the body mass index and vitamin D levels, okay, meaning that people with a higher body mass index, people who have too much fat, let's say, who weigh too much, tend to have a lower level of vitamin D. So in conclusion, in this cohort of COVID-19 patients, we found high prevalence of low vitamin D that was associated with an increased disease severity, likely through the excessive immune inflammatory response. Okay, and they show for the first time a significant association between vitamin D levels, male sex, glucose levels, and body mass index in COVID-19. So I hope you enjoyed this video. Let me know if you have any comments. I'm sure you have actually a lot of comments. Are you deficient in vitamin D? Do you have high blood glucose? Do you have diabetes? Have you been infected by SARS-CoV-2? Please let me know in the comments below. Like the video, subscribe to the channel, comment. Let's have a discussion on this. What is your experience with vitamin D? Do you take vitamin D supplementations? How often do you expose your skin to the sun in the spring, in the summer? Let us know where you live also, because that's quite important. And let us know if you have been infected by COVID-19 and if you have also measured your blood level of vitamin D. Let us know all of this in the comments below, and let's have a very interesting and meaningful discussion. Also, I wanted to mention that you can find a lot more very, very useful and interesting information on the stanbridgescientific.com website, where I will be adding more and more information and videos also every week. So go and have a look. I will also be adding videos and data on vaccine side effects and mortality due to COVID-19 vaccines, which, as you know, cannot be discussed on YouTube. And so I decided to just put this information regularly on the stanbridgescientific.com website under the COVID-19 tab. So go and have a look if you have not seen it yet. And you can also add your comments directly there. Okay, so we can also start a discussion on this website as well. So thanks a lot again for checking these videos and for liking them. And I will see you in the next video.